This is our today's question, which says a 55-year-old male patient has recently noticed a pigmented lesion which is measuring 2 centimeters over his back, which is increasing in size gradually. Which of the following forms of tissue diagnosis will you recommend for him? So just pause the video and try to read the question and the options and try to answer. But here I'm going to continue. So the most important clues which have been mentioned in the question are that it is a pigmented lesion and it is increasing in size gradually. So if you have thought of the diagnosis malignant melanoma, then probably you are thinking in a correct way. And please remember the answer here is excisional biopsy. I will tell you the reason. Please remember needle biopsy, incisional biopsy and Trucut biopsy. These are not the preferred forms or modalities of the biopsy techniques if we suspect a patient to have malignant melanoma. Please remember biopsy of any pigmented lesion. These are the lines taken from Harrison's textbook of internal medicine. So any pigmented cutaneous lesion that has changed in size or shape or has other features suggestive of malignant melanoma is a candidate for biopsy, and the modality of the biopsy is always excisional biopsy. There are few exceptions. I will tell the exceptions in the next slide. So with 1 to 3 millimeters margins is suggested, and also the facilities for pathologic exam assessment of the lesion permits accurate measurement of the thickness if the lesion is melanoma. Please remember thickness of the lesion is very important. I will tell you what is the reason for that. And as a general rule, no pigmented lesion should undergo incisional biopsy as there can be a risk of possible melanoma. But there are few exceptions. If at all the pigmented lesions are present over the face, hands and the feet, then these are the anatomic sites where excisional biopsy cannot be possible. So in that case, incisional biopsy is the preferred one after excisional biopsy. And for suspicious lesion, every attempt should be made to preserve the ability to assess the depth and also the peripheral margins and to perform immunohistochemistry. Okay, these will be dealt in the separate question. So, and also the biopsy should be read by pathologist who is experienced to study the pigmented lesions, and also the report should consist of Breslau's thickness or even Clark's levels, but Breslau's thickness is the preferred one. Why? Because this will give accurate measurement of the depth, which is very important in the case of malignant melanoma, because the assessment of the spread to the lymphatics and also to the internal organs is best done by the Breslau's thickness method. And please remember the lymphatic invasion is very important. Why? Because lymphatic spread is the most important modality of spread to the various other organs and the spread metastasis of the malignant melanoma.